Hi, my name's Sarah Drew and I'm the Primary Healthcare Program Manager at Gold Coast Primary Health Network. So our role is to support yourselves, the practices and the clinicians or the nurses that you're going to be working with during your placement in general practice. So following is a brief introduction in nursing in general practice. We hope you enjoy it and we look forward to seeing you on your placement.
Hey, my name's Michael. I'm a general practice nurse. I've been in the industry for about 5 years, worked across a lot of clinics. I really enjoy the work. It works really well for me because it's a 9 to 5 day. So I've been with the company My Health for about 3 years now. They bought out our clinic. I actively take a lot of interest in sort of training students, so you might meet me in second and third year. So I'm quite passionate about giving the advice I'm giving today on general practice, considering it as a graduate sort of position. It wasn't always sort of sunshine and puppies when I left uni. I spent about 5 to 6 months unemployed when I first came out, which was quite demoralising, made me think that maybe I was doing something wrong. If I had known about general practice when I'd come out of uni, I probably would have gone straight into it. I never thought I would enjoy it. I always thought I was one of those, emergency theatre, intensive care sort of nurses, as we all do when we want to leave. So general practice, it's a great area. I've worked in it for pretty much the majority of my nursing career, and I don't think I would ever leave it after I've begun. It's an area that prevents people from going to hospital, ideally, and that's primarily what we do. We take the load off the hospital by servicing all the minor things, but also all the chronic disease and things like that as well. So for those people that don't know much about general practice, it's the link between people living in the community and also being able to access healthcare without having to go to the hospital. So general practice is also sort of designed to keep the load off the hospital, which it does quite effectively, I think. It allows patients to monitor and improve their health from the community, and it provides them the means to see specialists, cardiologists, all through one sort of channel. Majority of the clinics are bulk billing or private billing, but you get a mixed bill sometimes for kids and pensioners. And it can range from having a couple of nurses up to 3 or 4 in my experience, maybe even more. Your day can change many times from the moment you walk in the door. That's what I like about it as well. So you come in the morning, you think you're going to have a nice cushy day, and then you have to call 3 ambulances as a result. I also love the hours. I mean, I've talked about that already. Work is not my life. I mean, I enjoy what I do, but I also have a life outside of work that I like to pursue as well. So I competitively ballroom dance. And the reason the GP works so well for me is because I can set my hours. If I want to leave at 1, I can leave at 1. If I don't want to come in on Tuesdays, I can do that as well. Another aspect of general practice, which I find really rewarding, is that you get to see your patients so much. In a hospital, you see a patient, you may not ever see them again. You may be lucky to see them 3 times in your lifetime. But in general practice, I see these patients, sometimes it's a good thing, sometimes it's a bad thing, but sometimes 20 or more times a year. So you develop really good sort of bonds with these patients, and they become your friends, for lack of a better word. It's not unusual for me to look through the waiting room and be able to tell you every person's name just by looking at their face, which is, I think that it really enhances your medical care as well. When you can see somebody and you know what they like and they don't like, and you can tailor a better sort of medical plan to sort of give them the best care that they can get. And it also, you find little things that people don't notice as well, which I think is great. So how do you get into general practice? You might have a couple of people asking. General practice, you're not going to see the numbers that you're going to see out of Queensland Health and private hospitals. Usually when people hire for general practice, they're only hiring 1, maybe 2 nurses tops. Having said that, I know every time that I look on Seek for jobs, or to give an example to a nursing student, there's always jobs going. And it's not about there's not jobs, it's where to look for them. Obviously you've got Seek and Career One and all those ones. I always find heaps of jobs all the time, general practice, all across the Gold Coast. And if you wanted to look, you could look into Tweed and Brisbane as well. I actually got my job by luck. I just went for a skin check with my general practitioner one day, and he offered me the job, which was really good because, you know, as I said, 6 months in, no job. I took it straight away. So you're going to provide a lot of sort of clinical procedures in general practice. So your head-to-toe assessments, ECGs, spirometries, injections. You're going to see a lot of injections, so you better get used to that now. Nursing students have never done so many intramusculars until they come on placement with me. They're pretty confident by the end of it. Practice nursing, it's not so much about the procedures, it's about keeping people independent in the community as well. A lot of the stuff you see in hospital, people are quite sick, but they all go somewhere. If they go home and they need support usually, and that's where general practice comes in. So you work with a lot of different people, doctors, physios, dietitians, all your allied health. On top of that, you've got medical students and nursing students running around with their heads cut off. But it's a really sort of, it's a very close environment. You're never going to be able to talk to a doctor like you do in general practice. These doctors have time to listen when you've got concerns about your patients. They're more likely to let you do all the wound care because they have no idea how to do it. And they'll ask you what's on the immunisation schedule for children because they've got no idea. So it's more about that trust. Everyone has knowledge to bring to the table. Everyone treats everyone equally. There's no pecking order, there's no hierarchy, and for me that's probably one of the best parts about it because we've all worked in the hospital and we've all seen quite a big sort of hierarchy. When you work in that environment, you don't bother the doctor, you always ask maybe the intern or the registrar. So if you get to the end of third year and you haven't heard anything about a graduate position in public or private hospitals or perhaps rural, maybe consider general practice. I didn't know it existed when I went through. I wish I had. I wouldn't have spent 5 months looking for a job. I would have jumped straight into it. Yeah, and maybe we'll bump shoulders in a clinic or something.